Day in the life of a nurse that works from home. Good morning. It's 7 a.m. I am getting ready for my shift as a virtual nurse. I know y'all always say this. Why you still gotta wear scrub? Because the patients and the nurses can still see me on the unit. Even though I'm working from home, when I turn the camera on, everybody can see you. Okay, so it's more for the look, But anyway, I already got my assignment. I got assigned a unit of patients. I'm on a med-surg unit, and we already had huddle, so I know exactly who I'm working with today. If you have been following me for a while and you enjoy the idea of virtual nursing, you want to learn more about it, the remote nurse staffing agency Nursing Connect has created training for nurses who are interested in getting into this field of nursing. So if you're interested in taking a course like this or getting more training, the link will be in the bio. And you can learn more about the remote nurse staffing agency Nursing Connect at nursingconnect.com. So after I get signed in, I'll do some chart checks on my patients, and then around 10 a.m. it's time for me to call in and start rounding. My daughter finally woke up this morning, so I went ahead and got her breakfast together and stuck her right with my sister. And then I was back to work. I'm also the admissions and discharge nurse, so anytime we get a new admission or it's time for a patient to get discharged, I'm the nurse that gets called to do the teaching and complete the admission assessments. I'm also a nurse that helps off with medication sign-offs. So if there's a nurse that needs to sign off on heparin, blood, insulin, I will also be the nurse they call to do things like that. So my shifts are usually 12-hour shifts. I get off at 7 p.m. And of course, some days are busier than others. It just depends on what the hospital needs from you that day. So shift report is pretty straightforward. I just leave a handoff for the night shift virtual nurse, and then I clock out from my station at 7 p.m. And that's my day.